Wolff Parkinson White (WPW) syndrome is a rare congenital heart condition that affects the electrical system of the heart, leading to abnormal heart rhythms or arrhythmias. It is characterized by the presence of an extra electrical pathway in the heart, which can cause episodes of rapid heart rate tachycardia. How WPW syndrome works. In a normal heart, electrical signals travel through a specific pathway to coordinate the heartbeat. These electrical signals travel from the upper chambers of the heart atria to the lower chambers ventricles via the atrioventricular AV node. In people with WPW syndrome, there is an additional abnormal pathway called an accessory pathway that allows electrical signals to bypass the AV node and travel directly from the atria to the ventricles. This can lead to a reentrant loop, where the electrical signal rapidly circles through the heart, causing the heart to beat excessively fast. Causes and risk factors. WPW syndrome is congenital, meaning it is present at birth, but its exact cause is not fully understood. The condition occurs when there is an extra electrical pathway between the atria and ventricles, and it may be inherited in some cases, although many instances arise sporadically without a clear genetic link. Some risk factors include genetics. WPW can sometimes run in families, suggesting a genetic predisposition, but most cases occur without a family history. Structural heart abnormalities. WPW syndrome can sometimes be associated with other heart conditions or structural heart abnormalities, but many individuals with WPW have no other heart issues. Symptoms of WPW syndrome. Some individuals with WPW syndrome may not experience symptoms, and the condition may be discovered incidentally during an electrocardiogram ECG or heart monitoring. However, when symptoms do occur, they may include rapid heartbeat palpitations, the most common symptom, often described as feeling like the heart is racing or fluttering in the chest. This can be triggered by physical activity, stress, or sometimes without any obvious cause. Dizziness or lightheadedness. The abnormal rapid heart rate can reduce blood flow to the brain, leading to dizziness, fainting, syncope, or near-fainting spells. Shortness of breath. As the heart beats excessively fast, it may not pump blood effectively, leading to difficulty breathing, especially during physical exertion. Chest pain or discomfort. Though less common, some individuals with WPW may experience chest pain, particularly during episodes of rapid heart rate. Fatigue. In some cases, people may feel unusually tired or weak due to poor blood circulation from abnormal heart rhythms. Diagnosis of WPW syndrome. WPW syndrome is typically diagnosed using an electrocardiogram ECG, which records the electrical activity of the heart. In WPW syndrome, the ECG will show a shortened PR interval less than 120 milliseconds, an abnormal delta wave, which is a flared-up stroke in the QRS complex of the ECG, representing the extra electrical pathway. In addition to an ECG, further tests may be used to assess the heart's rhythm and function. Holter monitor. A portable ECG monitor worn for 24 to 48 hours to detect irregular heart rhythms over time. Electrophysiology study (EPS), a specialized test that involves threading small catheters through blood vessels to the heart to map the electrical pathways and identify the location of the accessory pathway. Exercise testing. Sometimes, exercise is used to provoke symptoms of rapid heart rate to observe the response of the heart. Treatment of WPW syndrome. Treatment for WPW syndrome depends on the severity of symptoms, the presence of arrhythmias, and whether there are complications such as paroxysmal supraventricular tachycardia (PSVT), a type of abnormal fast heartbeat commonly associated with WPW. Treatment options may include medications, antiarrhythmic drugs. These medications are used to control abnormal heart rhythms, such as beta blockers or calcium channel blockers, which can help prevent episodes of tachycardia. Adenosine. In emergency situations, Adenosine may be used to rapidly slow the heart rate and restore normal rhythm during a tachycardia episode. Catheter ablation. This is considered the most effective treatment for WPW syndrome and is often used for people with recurrent or severe symptoms. During catheter ablation, the catheter is inserted through blood vessels and guided to the heart, where the extra electrical pathway is destroyed ablated using radiofrequency energy or cryotherapy cold therapy. This procedure can be highly successful in preventing future episodes of arrhythmia in most cases. Cardioversion. If the heart is in an abnormal rhythm such as tachycardia and medications do not work, electrical cardioversion may be used. This involves delivering a small electrical shock to the heart to restore normal rhythm. Lifestyle modifications. For some individuals, reducing stress, avoiding excessive caffeine or alcohol, and staying hydrated may help prevent episodes of arrhythmias, though lifestyle changes alone are generally not sufficient for treating WPW syndrome. Prognosis. For most individuals, WPW syndrome is manageable, and with appropriate treatment, symptoms can be controlled, and the risk of serious complications is low. If left untreated, episodes of paroxysmal supraventricular tachycardia (PSVT) or other arrhythmias can lead to more serious heart issues, including fainting or, in rare cases, sudden cardiac arrest. However, the overall prognosis for people with WPW syndrome is generally very good, especially with timely diagnosis and treatment. When to seek medical help. If you experience symptoms of abnormal heart rhythms, such as palpitations, dizziness, fainting, or shortness of breath, seek medical attention right away. If you have been diagnosed with WPW syndrome and experience any new or worsening symptoms, it is important to follow up with your healthcare provider to adjust treatment as needed. Conclusion. Wolff Parkinson White syndrome is a heart condition caused by an extra electrical pathway that can lead to rapid heart rates and arrhythmias. Although many individuals with WPW may not experience symptoms, the condition can cause discomfort or serious complications if left untreated. Effective treatments, including medication and catheter ablation, offer excellent outcomes, and most people with WPW syndrome can lead normal, healthy lives with proper management.